How is it that treating patients can be so fascinating? Doctors can now treat a disorder without using drugs or surgery, but rather inserting a gene into a patient's cells.
So what is gene therapy? So according to Merriam-Webster, gene is a unit of heredity which transferred from parents to offspring. It is also held to determine some characteristics of an offspring, while therapy is a treatment to a disease or disorder. So gene therapy aims to treat some underlying causes of disease such as changes in our genes.
Involves altering the genes inside your body cells in an effort to treat or stop disease, replaces a faulty gene or adds a new gene in an attempt to cure disease or improve your body's ability to fight diseases. It could enable patients to live without the need for ongoing treatments or the burden of daily disease management. Now, let's move on to the advantages of gene therapy in STS as a whole. First, it can prevent or potentially cure some genetic disorders from occurring, such as sickle cell anemia, cystic fibrosis, and beta thalassemia. Next, compared to other treatments which uses multiple doses to come into effect, with gene therapy, it is given as a one-time dose only. Another, it can potentially eliminate a person's symptoms permanently and can improve their lives. Moreover, once a defective gene is removed from the parents, that gene cannot transfer to the offspring. Lastly, as the technology advances over time, we can also anticipate that the technology of gene therapy will also progress. The disadvantages of gene therapy are as follows. It can be quite expensive, which makes some patients unaffordable. For instance, the most expensive drug in the United States is Zolgensma, a gene therapy used to treat spinal muscular atrophy. A treatment program costs $2.1 million. Despite its recent development, there are still many things we don't understand about gene therapy. There are currently no assurances, and it's yet unclear how effective gene therapy will be. There is some worry that gene therapy might have negative effects if it affects cells other than the defective cell in the body. There is also fear that undetected changes to reproductive cells could be passed on to people's offspring. It also raises ethical concerns for certain people. One such concern is who will determine the good and the bad applications of gene therapy. Lastly, some gene therapies deliver healthy genetic information into a sick cell in the body using inactivated viruses. These viruses may infect the patient who is undergoing treatment.